I was mad. I said, I've been good my whole life. I did all I was supposed to do. Well, I can't catch a break because now I can't walk. Can't talk. They take my teeth out. My hair fell out. So I was mad. I was just mad. But God gave it all back. Gave it all back.
Hi, welcome to Unseen Atlanta, an Atlanta Mission podcast, where we shine light on some of the city's toughest issues. I'm Rachel Reynolds, and I'm one of your hosts.
And I'm Jonathan Miller, your co-host.
We're going to be sharing true stories from real people who've experienced homelessness and addiction.
Each episode, you'll hear insights from subject matter experts who are leading the way towards transformation.
And we're going to be talking about Kisha today. It's such a unique story because it talks a lot about how a medical condition can lead to homelessness, which is not something people typically think about.
No. And we all know people, we've all experienced health crises. Yeah. But the reality is 70% of Americans are living paycheck to paycheck. So when a health crisis comes up, it can really derail your story.
Yeah. No, it is. It's something that I think for me personally, I think we build our lives around security. So we build our lives around financial security, where our kid's going to go to school. Are we living in a safe neighborhood? But the thing we really can't provide any safety for is health, if something goes wrong with our health. And so I think that's such an interesting thing because it's not just, I think a lot of times when we hear stories about homelessness, we can put like a spin on of like, oh, it's, us versus them. But we've all experienced health crises. We all are going to experience health crises. And so we're all just like one step away from this. So it's a really good story, and I cannot wait for you guys to hear it today. Thanks for being here.
Thanks for having me. I'm so excited.
No, thanks for having us.
You're welcome.
Honestly.
We're honored. You're our first guest.
I'm so excited.
So let's talk a little bit about how you got to Atlanta.
How I got to Atlanta. I got married. Came to Atlanta. My brother was here first, and he kept saying, come. And I was like, no, I'm a city girl. I can't come to Atlanta. Then I got married.
Okay.
But before I got married, it snowed real hard.
Like the day before you got married?
No, I got married in the snow. It snowed like at the beginning of January.
Okay.
So I got married at the end of January, and I was like, I can't keep doing the snow. So got married. So I was like, I'm coming to Georgia. And I came to Georgia. That's how I got down here.
Were you happy that you came?
I was happy I got married and I started a new life, and I get to be near my brother and my nephew, so I was happy.
And when was that? Was that in 2008?
That was 2018.
Okay.
Yes.
So tell me a little bit about when you came to Georgia, what was it like? What were you doing?
I was working at a lunch bakery. That was my first job. I went in and I sat down and I ate, and I was like, I want to work here because it was so nice.
What did you eat?
Make
you want to work there?
They have falafel.
Okay.
Falafel, hash browns,
okay,
and something else. And it was the ambiance for me. It was the niceness. Because it reminds you of Paris, and he studied in Paris. So I was like, oh my God, it's nice. I want to work here. And the line walked by, and they was like, that's a line. And I was like, oh, I want to work here. He was like, you do? Come see me tomorrow. And I went and he gave me the job, and I was there 5 years. So in the midst of that, I got sick. My arthritis started acting up. Okay. Because before 2018, I was sick, and all my skin fell off. So
your skin fell off?
Mm-hmm. Yeah, they helicoptered me to University of Michigan because one day my skin just cracked, like I had a scratch.
Okay.
And it just kept opening up. And so I was at work. I was a district manager for Taco Bell, and it scratched, and it kept falling off. And so my boss was like, you need to go to the hospital. And I was like, I know. It was just like flakes. And then I got to the hospital because I got a fever and I was sick. And then my skin the doctors touched me and it started to fall off. So I was like, oh my God, my skin's falling off. So it got really bad. And they helicoptered me to the University of Michigan. And they had me in a burn unit for 6 months, in the ICU for 6 months, because I had no skin, no hair, no teeth.
So was this something that you knew that you had, or was that the first time?
It was stress. The stress.
Stress caused it.
Caused it.
Okay.
The arthritis came after that. Okay. Because my bones were exposed. Okay. My joints was exposed when the skin fell off. So they call it the cousins. Psoriasis and psoriatic arthritis go hand in hand. Okay. So by me getting sick, that's how I got arthritis.
So is this something that was like some people in your family had?
It came, you know how your body is supposed to fight against stress, the antibodies, the white cell?
Yeah.
It went in reverse. Instead of protecting me, it went against me. That's why my skin fell off, because of the stress. And so the doctors didn't think I was going to make it, but hey, God said she is. So I left there, and then...
So did your skin regrow?
No, it did, because all this was gone. I was your color.
I mean, you obviously have skin now.
I have skin,
So,
but
okay.
it took protein. I had to have a lot
Okay.
of protein. And they sat me in a solution
Okay.
for 5 hours a day. Wow. Every day. They would get me out to bed because I couldn't walk, so they had to put me on this thing to move me to the solution. And then I ate a steak 3 times a day.
Yum.
Yeah, it was good. 3 times a day. And I drink protein shakes.
Yeah.
And then they put this stuff on. So every day of my life that I'm alive, I have to put steroids on my skin.
Okay.
Because it'll break out.
So since then, this has been something you've been dealing with. Okay.
So that's when I found out, when I worked at Alliance, that my legs were bad. Because eventually it kept going out. Couldn't walk. I would have to call off. And then I went to the doctor and they were like, I thought it was my weight, so I lost weight. I lost 100 pounds. I was
Wow.
like,
Okay.
my joints still hurt. I lost 100 pounds. So that's when they said, no, you have psoriatic arthritis. It's never going to go away. It's going to get worse. I was like, oh, wow. And it did.
Okay. So that happened. So you got diagnosed with psoriatic arthritis when you were working at Alon's. Okay.
So I was still there, 2018, 2019, 2020, 21. And then my legs really was bad. But he was closing that store down.
Okay.
He had, after COVID, he went from having 200 people working there to like 20 in a 10,000 square foot space store. He couldn't afford it no more. So he was like, well, I got the store in Virginia Highlands, and I got the store in Phipps Plaza. Virginia Highlands, those people aren't going anywhere. They've been there 35 years. They're not leaving, and it's only big as this room. He said, what about Phipps? I said, I can't stand on my legs that much no more because it was really bad. And he was like, all right. So I didn't go back to work. Applied for disability, and it didn't.
Were you and your husband together at this time?
Oh, no, I'm sorry. I skipped the whole part.
You did skip a whole. You buried the lead.
I married him, and it didn't work.
Okay. So
And
you married him. You guys moved here. How long before you guys got divorced?
2020.
Okay. So you were together for a
years.
couple years. Okay.
Yeah, I mean, he wasn't who I thought he was.
So were you living by yourself or were you with your brother?
No, I was living by myself.
Okay.
After I put him out, I sent him back to Fulton County, and I was like, you know, I can do this. And I did. I stayed working at Alliance. And then I got sick. And then I was by myself. And then I lost my job. My legs went out, and that's how it went.
Wow. Okay.
So October of 2023 is when I went to a restoration house. I did it for like 2 years by myself, but I couldn't do it no more. And then my best friend helped me because I had lost my job, right? I wasn't working. I had my savings, but I had went through my savings. And then my best friend, she lives in Detroit. She paid my bills for a whole year for me.
Wow.
Whole year. And then she had a triple bypass surgery because she owns a restaurant and she owns a food truck, but she couldn't do it, you know, by her being sick. And I told her, I don't need you to keep trying to help me because you got your own issues now, right?
Right.
And she was sad. She didn't want me to come to the shelter. And I said it'll be okay when I came to Restoration House.
So before we talk about that, what was it like living with, because you had obviously had this very traumatic bout of a flare up and when you were living in Detroit, all your skin fell. How did you like mentally stay living?
My friends, God, and God. I have one best friend.
Okay.
Not the one that paid my bills, because
Okay.
I've had my friends my whole life.
Yeah, you seem to have some good friends.
I do. I have, her name is Shamita,
Okay.
and she's amazing. Right?
Shout out Shamita.
Yeah, shout out to me.
She was there for me for the whole thing. From the day my skin fell, the first piece, I called her hysterical. She drove from Detroit to Ann Arbor 3 times a day to make sure I was okay.
Wow.
Wow.
And if she couldn't, because she has lupus, she sent her mom. Wow. She sent her dad. somebody came to check on me. And so when they put me in a helicopter, she couldn't ride in a helicopter with me, right? So she was like, you're going to be fine. God got you. I'll meet you at, because I'm in and out. My organs were,
Yeah.
they had to put that thing in my leg where they take the drill and they drill that hole. They call it it's the last thing. Like if they can't save you, they take a drill, a real drill, and they take a screw, a bolt. It has a hole in it. And they drill it into your leg, your knee, and then they pour the medicine in to get to your bones because all of your stuff have collapsed. But I was like, when he poured that in my leg, I sat up on the gurney. I said, don't do that no more. Me and God good. And I talked to him, and he said, I'm going to be okay, so don't do that no more. He was all like, yeah, okay, whatever. I'm just trying to save your life, but we're going to. So I was okay.
You have a lot of resiliency. Wow. So did you grow up with faith?
I did. My mom was strong.
Okay.
My mom was strong. My dad was faithful. My mom, we grew up going to the Kingdom Hall. First, we was going to church, and then we went to the Kingdom Hall. So my mom was like, God will be served in my house. But he's been good to me. So I believe that. And he's walked this journey with me. Because my mom died 25 years ago.
Wow.
And my dad died 40 years ago. So it's been me and my brother my whole rest of my life.
So you kind of had to build a family around you, it sounds like, with your friends.
Yeah.
My therapist calls it your chosen family.
Your chosen family.
Yes, your chosen family. She says that a lot of times we all have to build our chosen family. I'm building my chosen family right now.
That's cool.
And it sounds like you've really built that around yourself, which is really neat.
Yeah, I've had my same friends my whole life. 5th grade to right now, and I'm 50, I've had the same 5 friends.
Wow.
Same, never fell out.
That's pretty incredible.
Yeah. So when I had to come, my best friend was sad. She wanted me to come back to Michigan. I'm like, no, because my nephew is here. I love him. He's so amazing. And I don't have no kids. So it's just really me, my brother, and my nephew. Well, his wife, she's nice.
Okay. She can stay. So, yeah, it sounds like your faith and your community really helped you.
They did.
Because that had to be a very, not only physically challenging time, but mentally challenging time.
I was mad.
Oh, I
was mad. I said I've been good my whole life. I did all I was supposed to do. Well, I can't catch a break. I was mad when my skin fell off because now I can't walk, can't talk. They had to take my teeth out. My hair fell out. I have gray hair, right? Like my dad gave me gray hair. So I was mad. I was just mad. But God gave it all back. Gave it all back. Even now.
So, Kisha, we just wanted to ask you, we're called Unseen Atlanta.
Okay.
So what is it like to be unseen?
You feel invisible. I grew up like that. My brother was the favorite. So I always had to do extra so my mom could see me. And no matter how much I did, my brother was always the favorite. I called him Jesus because he could walk on water to my mom. So it's hard to be unseen. You feel bad. Like, no matter what you do, it's not enough. So you got to do extra so they can see you. And I did.
Tell us about what it was like when you had to come to Restoration House.
I was mad. I cried hard because I was like, I'm 50. I've been good. I did what I was supposed to do. I helped my fellow man. I fed. Because I met this lady. Can I tell you that story real quick?
Yes.
I met this lady.
That's why we're here.
I met this lady back in probably 2002. I worked at a gas station in Detroit. She was a lady. She came into my store every day. She bought $20 worth of gas, and she gave us $20.
Oh, okay.
And she would say, if somebody comes in here and they're hungry or they don't got enough gas, you take it out this $20. She did that every day. Wonderful lady. Worked at Blue Cross Blue Shield. She was a corporate payroll lady. So one day, after months of that, I said, hey, can I ask you, why do you give us that money every day? She said, my brother walked away from our house over 20 years ago. I never seen him again. My mom is devastated. But I pay it forward because if my brother's in the world and he's hungry, he's thirsty, maybe if I do this, somebody will help my brother. And I was like, wow, okay. So ever since that day, I remembered that. So I always paid it forward because people have been good to me in my life. So when I got here, I was like, man, I did what I was supposed to do, but I'm still here. So I was hurt. I cried. But the women that I encountered that did my intake at Restoration House, Miss Daphne, Miss Jasmine, Miss Cheryl, they were good to me. And they said it's going to be okay. And it was. It is. Then I got to my sister's house and I cried. I did. I was emotional because I'm like, whoa, why am I homeless? Because I followed the rules. And I was mad at God. I was. But then I was like, okay, he been good to me. So all I kept saying was it has to be a lesson. Got to be something I didn't do right or I missed. I thought I was humble, but then I learned a lot about myself when I got here.
Yeah. I think one of the things that people don't understand is how much courage it takes to walk through the doors for the first time. Tell us like a little bit about how that felt.
I had a little relief,
Okay.
but I laughed, and let me tell you why.
Okay.
Because the whole time when I was struggling and I couldn't pay my bills and people kept saying, oh, get a roommate. I said, no, I never had a roommate in my life. I took care of myself, and I don't like a lot of girls like that. You know, I'm not getting a roommate. But then I got to Atlanta Mission. 200 roommates.
You're like, joke's on me.
Joke's on me, right?
200 of us.
Right. So I was like, okay, God, I see you. Because I said I couldn't and I wouldn't. And he said, I'm going to show you will. And you will. And I did. And I was like, okay. I still was like, okay. So I listened to them doing the orientation. And I said, do what you got to do. Come here, follow the rules, do what you got to do. Because I'm real strong-willed. And my mom's been dead 25 years, so I was grown. You know, people can't be telling me what to do. What do you mean I got to go to bed? It's 10 o'clock. So, no, do what you got to do. And this is what I said. And I did.
Yeah.
Now, I'm not going to lie to you guys and be like, oh, it's been peaches and cream. It's been bumps in this road.
Yeah.
It's a year.
Well, that's life.
That's life, right? I did what I had to do. Put on my big girl pants, and I did what I had to do. And, it was hard. It was hard. But I'm appreciative of Atlanta Mission.
You talk about those kind of ebbs and flows. I mean, I think a lot of the journey that people take at our shelters, it's the ebbs and flows. But that's life.
That's life. You're gonna
Every
have
day,
those.
every day is a battle of, you know, it might look different for every different people. But yeah, how did you stay like in a good mental place with the ebbs and flows?
I prayed a lot. I read my Bible a lot. And I talked to women that was there that have been on this journey long before I got here. And they told me like, hey, this is going to work if you do the work. You got to do the work. I had to do the work. I can go sit on the couch and talk to Miss Shay. She can pour into me. But if I don't do the work, I'm not going to work. So I said, this is the first time in my life. This is what I said. And I told people, this is the first time in my life that God has allowed me to sit down free of charge to get my life together, to fix me. No bills, no rent, no food, no clothes. I had to do nothing, right? So when am I going to be able to do this again? No, I'm not. Use it. Get what I need to get out of it. Learn from it. And when I needed to go lay on Miss Shay's couch, I did, and I cried, and I poured my soul out to her. And so it worked for me. That's what I got out of it.
I feel like we should bottle up her mentality. I need it.
Yeah, absolutely.
Like, you have such incredible perspective. I think that's like half the battle is having perspective in order to keep going. And I think we should have like Kisha perspective in a bottle.
I know,
We
and,
can make a lot of money on that.
I know, right? I hope so.
and I'm just like sitting here. I'm just like, I just want to hear all the things.
I know,
Like,
me too.
what were some of the you keep talking about? Like, I learned so many lessons. Like, can you share some of those pieces of wisdom with us?
Listen, you got to listen. Listen and silent have the same letters. I was writing one day, and I looked at the letters and I said, oh, listen and silent has the same letters. So you got to be silent so that you can listen. Get it. Because some people, times we just talk and talk and talk. And I remember my mom
I know
said
all
to me-
about that.
Me too. Took me a long time to get to this point in my life. Because I'm
Getting a lesson right now.
You got it?
Yes, go, keep going.
So yeah, you have to listen and be quiet because God's talking to you. And so if you don't listen and you just talking, you're going to miss the lesson, right? That's what I got. I had to listen. I had to be quiet because my mouth would get me in trouble. Because I told you I thought I was grown. I am grown. But I was like, hey, my mom gone. That's the only person I had to do. I cared enough about because I'm scared of her, So after that, I was like, I'm grown. I can do what I want to do. I take care of myself for a long time. I raised my brother and I'm good. So when I got here, it was like, okay, I got to listen. And I stopped and I listened. I didn't gossip. I stayed out the mix of, because that'll get you
Once again, 200 women.
200 women. No. and the manager and me made it a little easy because I dealt with different personalities. They call me a social butterfly. And they be like, oh, Kisha, such a social. Because you got to be charming. I had 80 people working for me at one time in one place. So I have to know how to get people to do what you need them to do for you, right?
Yeah.
So you got to be charming, you got to listen, you got to pay attention, you got to focus. So I'm like, how did I get here? So I had to reel it all back in. Listen, pay attention, and focus so that I can do what I need to do to get to the finish line. And I'm 16 days from the finish line.
16 days?
Mm-hmm.
Wow.
That's awesome.
How was your health when you were at the mission?
It was bad.
Oh, okay.
So at first it was good. I got there, I could walk and talk, and everything was good. And then I went to JSW.
Which is Job Search Workshop.
So I was excited. I did transformations, and I was excited. And then the day after we graduated,
Okay.
job search. I couldn't walk.
No.
Woke up, could not get out of my bed. My legs was like, ha, ha. Yeah, okay, because that was death, right? I missed the first day of job search, and I was crying. And Miss Easy was like, what's wrong? I said, I cannot walk. And they was like, oh, my God. So I had to limp, hop to the front, to the desk. And so Miss Easy was like, what you going to do? So I was like, I don't want no cane, because I had already overcame that. And then my legs was like, And Miss Edith went downstairs and got me a cane.
Okay.
So I didn't go to job search. They had to give me workman's comp to be off to get better. And shout out to Mr. Vincent. He's gone now, but him and Miss Simone and Mr. Green made sure I was okay. Mm-hmm. So I was off, and I couldn't walk. And I was like, I gotta get a job. Because now I'm scared.
Right.
Now I'm scared. I'm like, I can't walk when I'm due. So I would take my cane to my job interviews, and I would leave it outside the door.
So people didn't know.
So they didn't know.
Yeah.
Because I'm already older.
Right.
And I can't walk. They're gonna be like, girl, go on. We ain't got time.
So were you under any medical care at that time?
Mm-hmm.
So where were you doing that at?
Good Sam. Listen, I love Good Samaritan.
Tell me.
I love Good Samaritan.
Okay, why?
They took great care of me.
Really? Did you start with them like right away when you got to?
I started with them when I got there and I couldn't walk.
Okay.
I was going. Because
Okay.
other than that, I don't really need nothing.
Yeah.
But my legs was messed up. I was like, oh my God. So they made sure I had all my medications. They did my x-rays. They paid for my specialist that I had to go to. They got me on this shot that cost $17,000 for 2 injections. They got me approved for it. I didn't have to pay $1.
So you had some good medical care with Good Samaritan.
Yes.
That's
so much that they're my doctors now that I got.
Oh, really?
Good insurance now. I got a job. And so I had 1 day left to find me a job.
Okay.
1 day. So I had went on this interview.
I'm feeling stressed for you in 1 day.
I was like, oh my God, what am I doing? I got to find a job.
Yeah.
And I'm on this cane and I can't walk. So I found a job.
Okay.
At Gear's Popcorn in Lenox Mall.
Yum.
Yeah, they was like, oh, you got manager experience, 31 years, you should come. Mm-hmm. But then I had this interview at Rooms to Go, and it was better.
Oh,
and it
yeah.
was finance manager.
Oh, okay.
And I was like, I really want this job. God, I really want this job. I prayed and prayed and prayed. And I talked to Miss Pat, and she was like, you been obedient? Tell God what you want. And I was like, okay. And I prayed about it. So I was on my way to Lenox to do my paperwork. I had to catch the train. And I got off the train and my phone rang. and there was rooms to go. And they was like, hey, Kish, you know, this is Suzanne, and I just want to give you this job. I said, oh, my God, really? I got the job? She was like, yeah. So I called Garrett's because I want to be grateful because I'm thankful you gave me a job. I'm sorry, sir, I had a better offer, but I appreciate you. And he said, you know what? They're so professional. Thank you. If you ever need something, you come and see me. And I said, okay. So now I work at Rooms to Go in Buckhead.
How is it?
I love it.
That's awesome.
I love it. And they've been good to me. They've been good
Good.
to me. So how I got the job was my legs was bad.
Yeah.
Couldn't walk. And so I get to Good Samaritan, and Dr. Katie, her name's Dr. Katie, and I said, they had me on prednisone,
Yep.
and it made me feel good. Like I could walk. She was like, oh, we can't give you no more prednisone. I said, why? She was like, steroids and side effects. And I said, listen, it's just a conversation I had with her. I said, listen, if you give me 10 pills, because that's what they would give you, 10 pills, because you got to take 3, 5, 2, whatever. I said, if you give them to me and get me through this interview, I'm going to do the rest. I just need you to get me through the door. And I would never ask you for another prednisone, I promise. She was like, I said, I need this job. I really do. So she gave him to me. I took
Oh,
him.
go Dr. Katie.
Go
Shout
Dr.
out,
Katie.
Shout out.
Shout out to Dr. Katie. She gave him to me. She said, this is it. Don't take him to Sunday. She said, when's your interview? I said, I think it was Wednesday. She said, don't take him to Sunday because you got to do the countdown.
Right.
I took him. I walked in there. I got the job Rooms to Go. And I went back to Miss Katie and I said, can I hug you? She said, you're a woman of your word. You said if I gave you the pills, you would do the rest. And I did. And I've been working there for 6 months.
Wow. Congratulations.
Thank you. Thank you.
That's amazing. Okay, so you're 16 days from move out. How are you feeling?
I was a little scared,
Yeah.
but I'm excited.
Okay.
But I was a little scared
Yep.
because I've been there a year.
I
Been there
know.
a year.
They're your people now.
I know, right? And I met some amazing women. But I was scared because I'm like, what am I going to do? I've been back here for so long. It's almost like protection, right? It's like I know that when I get off the bus or I get out the lift that I'm going. So I'm excited though.
Yeah.
I am.
Well, I mean, life will still be life and once you get out there.
Life will be life.
But it sounds like you have some really good tools.
I think I do.
Is that how you feel?
I do. I know what to do.
Yeah.
I know what not to do.
Yeah.
And I'm ready. Because to me, life is all about being ready. Got to be ready. That's why my marriage didn't last, because I was ready. My husband wasn't ready. So when you do go out into behind those gates, you got to be ready. You got to use all your tools that they gave us while we was in there. You know, conflict management, financing. You got to know how to save your money. I've saved my money. JSW taught me how to know the deepest truth of who you are, right? And I use those tools to be proactive, be professional at work. So when I go to work, I'm always professional. And, you know, the lady at Rooms to Go, she's like high up. She came to me the other day and she made me feel so good. She was like, you know, Kish, you are so professional. Even when your supervisors aren't here, I wish I could hire 5 of you. And my store would run amazing. That made me feel good, right? Because I know I go in there and I give my all and I do my job. But I'm going to use my tools that I got from Atlanta Mission.
What is the deepest truth of who you are?
That I'm a hard worker. I am very resilient, like you said. I have no regrets in life, right? Because if you do, I learned this. Whatever you do, that's what you wanted to do in that moment, right? So I have no regrets, but I have no remorse. I have redemption, though, because I know God's going to make it right. So the deepest truth of who I am is I'm a survivor.
Yeah, you are.
Wow.
And I'm always going to get up and go get it. So I know that about me.
Yeah.
And I love that about me. And sometimes I'm too nice. I know that about me. My roommate calls me, she be like, Kish, you see the benefit of the doubt in everybody. Because sometimes people have moments, and we got to be kind to people.
Yeah.
And so once I see you for who you are, though, then I see you for who you are. But every person has a story that's walking through those doors. We don't know. So you be kind to people. You say, good morning, how you doing? Edify and uplift. I wasn't always that person, though. I wasn't, but I am today. I always have a kind word because the best lesson Miss Stephanie told me, because they allowed me to work as a peer leader, right? She said, serve with love. Be kind to people. And if you can't be kind, don't hurt nobody. So every morning when people would come to the desk, because I worked at the front desk, I would be like, good morning. Have a great day on purpose. Don't let nobody steal your joy. Because you got to feed life into people when they're going into the world. The world is not a good place sometimes. So I learned that. Give life. And if I can't give you life, I'm not going to say nothing to you.
But you know the world's a better place because you're in it.
Ah,
So you make the world a good place.
Absolutely.
I try. Don't make me cry. I cry really easy.
Oh, you do? That's okay. I love a crier. I'm not a crier, but I love a crier.
I love suppressing a cry.
I attract criers.
My mom was not a crier. If I saw my mom cry twice. My dad died.
Yeah.
And when I had made her so mad and I came home and the priest was at my house, she was crying. I was like, ooh, somebody in trouble. So I'm a crier. But it take a lot, though. If it's something that really moves me, then I will cry. So you said I'm better, make the world better.
You
that
do.
way?
You make the world better.
I try.
You have so much light.
As we wrap up, and you think about your future, what gives you the most hope?
That I'm going to be able to come back. I look so forward to coming back.
Really?
To Atlanta, Michigan, to talk to people. But what gives me hope is that I know that I won't have to do this journey again. I got it. I do. And I know I shouldn't, but confidence is everything, right? You know what I told you? Got to be confident that I got it. I'm going to do it right. And I'm going to come back so I can say a kind word to somebody and let them know that you can do this. You know, it gets hard sometimes. And this don't make us bad people. This makes us resilient, strong people. Because we know what not to do next time. Hopefully we learn how to save our money, how to make better choices. Because that's all that got us here.
Yeah.
Not the right choices. So.
Well, thank you for sharing your story with us.
Yeah, thank you.
That was amazing.
It was a gift.
I had fun. This was fun.
Well, we hope you guys enjoyed Kisha's story. I know we did. She was so amazing, just sharing all about just her struggles. But I think the thing with her that was really stood out, she has such a beautiful spirit. She's so resilient in the face of so many things that she had gone through. And Kisha talks about in her story the medical care that she got while at Atlanta Mission. And so we thought, you know what? Why don't we bring you someone for a subject matter expert who can talk about that medical care? We have with us Breanna Lathrop. I said that right?
You did.
Oh, yay.
Excellent.
Okay. And she is the CEO of Good Samaritan.
Good Samaritan Health Center.
Yes.
Excellent.
Tell us, Breanna, a little bit about you and what you do at Good Sam.
Of course. So Good Samaritan Health Center has actually been in Atlanta for 26 years now, and we're a nonprofit with a mission of spreading Christ's love through quality health care to those in need. So we specifically serve individuals and families at or below 200% of the federal poverty level. About 80% of our patient population is uninsured. Some patients have Medicaid, Medicare, and we serve throughout the Atlanta metro region. And just like a really diverse group of incredible people. I feel really just incredibly lucky to get to do the work that I do with my colleagues and with my patients. I am a nurse practitioner, and I see patients about 50% of my time at the clinic, and will continue to do that.
Even as CEO, she's going to continue to do that.
Is my first love.
That's crazy.
And it fuels what we do, right?
Yeah,
like being
no, it
close
does.
to the people
Yeah.
and connecting and seeing the way policies or decisions play out really helps inform the work that we do. Our founder, Dr. Bill Warren, is a pediatrician and still sees patients at the clinic.
So it's like infused into the
is.
DNA.
It really is, yeah. And I love all of our team, no matter whether it is our farmers that are working the urban farm that we have on site, our counselors, our dentists, our medical team, those that fundraise. Everyone is just really connected to that mission and the stories of the people that we serve. And I think that just builds our community. I'm going into my 16th year at Good Samaritan.
Wow.
And just again, just really love what I do there, and continue to just learn from the people that we see and the people that I get to work with.
Yeah.
Excellent. And actually, sort of a fun fact, Good Samaritan actually has a clinic at Atlanta Mission.
Yeah, tell us about that.
Yeah.
I am so excited. So as of January 2nd, we have opened at Restoration House. We're opening with Monday, Wednesdays, and Thursdays, full days.
Wow.
To just have another point of entry for people to access us easier, expand how many people we can see, and also just be able to do this in community with Atlanta Mission, which is a longtime partner since we opened, really.
Yeah.
And just could not be more excited to do this work with someone that we know and trust the way we do, Atlanta Mission.
How many sites do you have?
So right now that is we have one site and then the Restoration House.
Okay.
So
we're your second. Great.
Yeah, second site. We do some outreach different places and kind of pop-up clinics and such, but this will be our first true satellite clinic.
Wow, this is so exciting.
That is exciting.
I'm not part of it.
So you see a lot of patients that are underinsured. A lot of our clients will end up going to Good Sam for care. And now that we have this partnership, even more. Tell us how you prepare your clinicians to see patient populations that are low income to no income.
Experiencing trauma.
What is that like for your clinicians?
Absolutely. So I think first is that you build your own internal resiliency. And so, for example, some of that has to do with our mission. And we start each morning with a time of shared devotion and prayer to just center ourselves and the work that we do and why it matters. And also just recentering ourselves always to that each person is beautifully and wonderfully created. And if they haven't been told that or felt that, our goal is that they feel that when they walk in, and the way that they're treated, the way that they're respected, and the way that we can meet their goals, not just a list or an agenda that the medical record may tell us is due. And then I think we build on that foundation and just our relationships with one another. And then from there, there's training involved. So as we hire new employees, they do some equity-based module training to learn what is health equity? What are social determinants of health? What is some of the data around the disparities that are being experienced by the communities that we serve? We have a staff meeting monthly, and we devote several of those to hearing from just people with lived experience or expertise in different areas to help challenge the way we think about situations that our patients may face. This year, for example, we did a day-long mental health first aid training so that every employee will have mental health first aid certification.
Wow.
And so it's a learning process. And sometimes when we try new things or we move new places or a pandemic appears, we find out we need new skill set. And I think the idea is that the moment you say we're sufficiently prepared or we've learned everything we need to know is the moment we better get out of medicine, right? The goal is that every day we're examining our own biases, the narratives that may not be true, that we're hearing the stories of our patients, and that we're asking ourselves, so what does it look like to do better? How do we keep learning and growing and changing?
Yeah, that's so great. You said mental first aid, and I don't think I've ever put those words together in that order.
I'm thinking a first aid kit with a
Band-Aids
flap. Yeah. And some Tylenol.
Yeah. So mental health first aid is the idea that we all as a society do a better job of addressing mental health crises and challenges when we're all equipped to do it. So what I love about this training is it's an evidence-based practice that's been rolled out. Multiple nations have done it. Multiple states have done it around the idea that what if we equipped everyone to be able to recognize the signs of mental health illness and distress, and then respond in ways that are loving and de-escalating, meaning helping people feel calm and safe to have those feelings and get in a place where they can think about their next steps. Yeah. And so we know that for a lot of people, the first people that they talk to if they're feeling overwhelmed or depressed or even psychotic are the people that they trust. That may or may not be anyone with a medical background. More often than not, it's not, right? It's a friend. It's a family member. Maybe it's the person that's their housing case manager. Maybe they're seeking legal assistance, or they're having interaction with law enforcement because there's a crisis. And the more of those types of individuals that get this training, the better that we are able to identify, okay, this is a crisis. Let's respond in a way that is compassionate and helpful. We're also excited because we have staff members that have now trained to be trainers. And so we'll actually offer this certification to partners as well as our patients. So starting this year, we'll actually be hosting it's a day-long training session so that anyone that's in partnership with us or receiving care through us that wants to improve their skill set can come and do that. And I think that's really when we start to move the needle on understanding and doing a better job around mental health care in the U.S. in general.
Yeah.
That's such a great thing you guys are doing, because for mental health, there's a lot of stigmas around it, and people don't know what they don't know.
Yeah.
And so you're providing a pathway for people to have greater understanding that will lead to greater empathy.
Yeah.
And people will feel cared and loved.
Yeah. It's easy to see when someone's broken their foot or their leg, but it's harder to see when someone's struggling with something mentally. I think something Kisha talks about a lot, and we hear a lot from our clients, is that their homelessness kind of started they actually started getting into homelessness because of some sort of medical situation. Unable to work in a medical situation. They find themselves here, and then they find themselves homeless. Is this something you see a lot?
All the time. It's really interesting as we meet with patients, and a lot of what we do is trying to understand their story. I think sometimes there's this sense of like, what's wrong? Let's fix it.
Right, totally.
But a different approach is to say, like, tell me your story. Like, what happened to you? And what we hear are that most of the people that find themselves in spaces of homelessness have stories of thriving and resiliency and skill sets and education and family and just all this beautiful picture of like what makes them a person. And the burden of homelessness isn't something that they caused or did. It's a combination of things that go wrong, which can be health related, but also a broken society that doesn't have a sufficient safety net that starts early enough in the process. And it allows people to get really sick and really poor and really disadvantaged before the systems click in to help. And sometimes they even don't then, right? And so I am always amazed that patients come in and the amount of phone calls and places they've gone and things they've done while being sick, hurt, injured is amazing to me. Like, I don't know that I can do that, right? And I just think, like, to me, that is such a loss, like that so much energy and passion and time has been wasted in people jumping through hoops and trying to navigate these complex systems of the social safety net to get to a place where more harm's been done than necessary.
I love how bluntly you put that. I like people who are blunt. And I like that you put, like, you're so sick, it makes you poor. And then, like, you put it so bluntly of, like, this is what happens, and it's terrible, and there's not a safety net there for them. So they end up in these situations. But I also was thinking when you said you sit down and ask them their story, I was like, I'm not sure I've ever had a doctor sit down with me and ask me my story. And you're totally flipping the script on what it means to be a medical provider.
That's our hope. It is hard, and I am personally still learning. Yeah. We're still learning. And it's hard to do both well. It's hard to keep up and see patients and meet the need and make sure you're following evidence-based care, and then also be a friend and be like a compassionate human. And some days you like leave and you're like, yes.
I did.
And some days you're like, oh man. But let me tell you a quick story that was like a huge learning moment for us. So in 2015, we started a specific every Friday being a walk-in clinic specifically for people experiencing homelessness.
Okay.
Because we asked, like, what's making healthcare difficult? And it was like, we have to make an appointment. You have to know in advance. Then what if your transportation falls through or you move?
There's
all
so
these
many things before even going to the door.
Exactly. And they were like, and then if you get a prescription, you have to find a pharmacy. And then what if you don't have money for the medication? So we were like, well, let's just try this and let's have a clinic that's 100% walk-in. You can do like medical and psychology, psychiatry same day. okay, we dispense the meds on site, so there's no, the medicine leaves with you. And then we added things like, also, let's make sure you have a meal while you're there. And then we have a van that does a loop around the downtown to help people get to us, and continuing to kind of address these larger social determinants. And a few years in, the interesting thing we found is that about 70% of patients that were seen on Fridays were following up. Like, they were getting mammograms and pap smears, and they were controlling their diabetes. They were doing all the things that we hope any general person uses primary care for, right? And to me, it was this moment of saying, like, if the barriers get removed and healthcare is willing to be more flexible, the people aren't the problem. They are engaging and they are getting healthier. So we took it a step further and we said, okay, we should, and this is a learning point I keep learning is, so you should just keep asking so you can learn more, right?
Yeah.
So I said, we can make assumptions about why people come back, but we could do a better job if we actually asked people.
Yeah, ask them.
So we did like a qualitative study. Like, we had a Rollins student come in, graduate level, to help us conduct these, and IRB, we did it right. And we did long interviews of 20 people, and we asked, like, why did you come back? And I had my theories. And like many times in my life, I was wrong.
Right, of course.
Because I was
we
like,
love our hypotheses.
oh my gosh, right. And I'm wrong all the time.
100%.
I feel like most of my life is spent just like unlearning and relearning things. And that's great. Just embrace that. But, and I thought, like, maybe it's because there's a meal, or the medicine is free, or you can see both providers in one day, all these reasons, right? The number one reason that people came back is because they identified someone on staff that they felt like a family or friend. The number of times people in there had direct quotes about someone knowing their name. And I mean, I still cry reading those transcripts, right? Because I just think, like, of all of the needs, like, what people needed most was to be, like, seen for the beautiful people that they were, to be seen not as their condition or their problem, but to be seen as a human being deserving of care. And just the power that is in relationships. And so to me, it's this reminder that, like, we can grow and we can develop programs, but not at the cost of the space in which people build relationships and trust. And at the core of good healthcare, if that dissolves, like, you don't have anything left. And so I think that for me is this coming back to point of, like, how do we protect that kind of sacred piece of, like, trust and relationship? And how do we protect that and help that thrive as we build and expand around it?
That was amazing.
Wow. Well, and I think, I know, I can't even.
And that so resonates with what we're trying to do.
Well, because we talk about how homelessness is often referred to as, you just see the physical poverty of somebody. But at Atlanta Mission, we've made a concerted effort in the last 10 years to say the greatest need of our clients, the greatest need of humanity is relational poverty.
It's connection.
It's connection. And so we feel like the biggest need our clients have is this need for relationship. And I love that you've taken something that feels very clinical and sterile, like medical care, and said, no, we're infusing relationship into this. We can't separate them. You've really flipped the script.
And you're seeing better outcomes.
Right.
Yes.
And if you don't have relationship, you also don't get to really understand what people need in terms of next steps, right? Like, if patients think that they've got 5 minutes and that all we do is medicine, they're not going to tell me that they're not taking their medicine because there's nowhere safe to store it, or that no one explained it to them and they don't trust it, or that they experienced harm at the hands of their last healthcare provider, and it's made them really fearful to accept a diagnosis, or that their biggest need today is to have someone to talk to about a trauma that happened, or to set up their application for SNAP benefits. And I think that, like, to me, relationship is also how you do a better job of understanding the whole picture of what makes someone healthy, and then really being able to say, okay, what is our piece and how do we keep working on that whole picture of what you need to thrive?
Well, you've taken the tangible medical care and also infused the intangible, which is the heart, mind, soul care with it. And I think that's what's you can't have one without the other.
Right.
I think we like put them in these like very specific buckets of like, no, you just provide food. No, you just provide medicine. No, you just provide housing. But if we take out the relationships, we take out that that intangible soul care, then we're doing ourselves a disservice.
Right.
So I feel like you so eloquently put that, and that was amazing.
And real quick, as we wrap up, Breanna, can you tell us, how do we find, if someone wanted to get involved and find you, Good Samaritan, how would we do that?
Yes.
So come to our website, goodSamAtlanta.org, and everything is on there. Like from if you want to figure out how to be a patient and get care for where we're located, but it's also where you can find us if you want to help support us and donate and build our work.
Help support them.
Or if you want to volunteer.
I'd support her.
Thank you. I mean, we need that.
Yes. Are you all funded by individuals?
The majority of our funding is fundraised. So that is individuals and grants and corporations and all of it. And then many of our patients contribute and pay on a sliding scale fee, but it is 80% of our budget gets fundraised. So we are always raising that. Every year you're starting back. And so it's also, to me, is that sometimes that's also how we're in community with one another, right?
Yeah.
Like that when we have donors come through or we're working collaboratively on the next project and thinking about outcomes, is also a space where we get to share with one another. And I think it's a space in which we get to challenge each other on maybe some of those misconceptions or false narratives that we have around some of these issues. And it helps all of us, not only in the day-to-day work, like at the clinic or at the mission, but it also helps us as citizens. Like, how are we showing up in the world as humans from not only when we've got our job hats on, but when we're people in our communities, that's the crux of health equity, right? It's that we're all thinking in those moment-to-moment decisions about, like, what can we do that makes it possible for everyone to live a healthy life.
Yeah. Well, and I hope our listeners get to hear another great organization that we love for you guys to get to be a part of. They're meeting such a tangible need in our community. And I think us as nonprofits sometimes do a really bad job of promoting each other. And so I think it's a really great, I'm so glad you were here today, because we can't thrive without each other. Exactly. Our organizations can't thrive without each other. And I really hope that everyone who's listening to this knows we just want you to get involved somewhere. It may not be Atlanta Mission. It may not be Good Sam, but we want you to see something that you are passionate about, that you feel like you can be involved in, and go do it. Because without you, so you fuel our missions, and we can't do the work without it. So I think that this was so much more than just talking about healthcare. I think it's talking about how we as nonprofits all work together, how we need each other, but also how we need our communities. So thank you so much for being here.
Thanks for having me.
People are going to love this episode. And I think
I loved it.
Oh my gosh. I'm like, I could talk to you all day, but
we might have to do this again.
Oh,
for
you'll be back.
Sure.
You'll be back.
Wait, it's over?
You'll 100% be back. So we hope you enjoyed this episode as much as we did, and we really hope you go check out the website. It's GoodSamAtlanta.org, and we hope you want to get involved there, because I know I want to get involved there. So we hope you continue to listen, and we will see you next time. Bye.
Thank you so much for listening and engaging with these challenging yet vital conversations about mental health, addiction, homelessness, and trauma in our city. Facing these issues head on is how we ignite real transformation in Atlanta. Thank you to our season sponsor, the Scott Pryor Law Group. The transformation you've heard wouldn't be possible without incredible partners like the Scott Pryor Law Group, personal injury and accident attorneys. Their compassion and dedication to our community fuel stories of transformation just like these. If you are injured in a semi-truck or car accident, call the Scott Pryor Law Group. As a U.S. Marine, we fight and win for you. Our clients are family for life. We handle all types of injuries. You focus on healing, and we handle the rest. Now, if today's episode inspired you to take the next step, we would love to invite you to join the work that God is doing here. There are two really impactful ways for you to get involved. First, you can give financially to help us continue the work you heard about today. Second, you can volunteer your time by serving at one of our campuses. You can find all the ways to give and get involved at atlantamission.org. Thank you again for being part of this journey. Please join us next time as we uncover more powerful stories of hope and transformation.